Hi, my name is Rebecca. I am going to be talking about Yi, who is a refugee from Vietnam, and he came to Australia as an asylum seeker in the 1970s when he was in his 30s. So Yi is an inpatient at the rehab hospital that I was doing prac on, and Yi suffered from an intracranial bleed. Yi was admitted approximately 2 months ago now into the hospital. So I've got the privilege of having a good friend who's also Vietnamese, so he could shed some light on the cultural norms in Vietnam, and this assisted in my reflection on how Yi's culture has impacted on his rehabilitation program. So Vietnam is a country which values family and community over individualism, whereas we know Australia is a country which is very individualistic, I'd say also opportunistic and capitalist. So Vietnam is also relatively poor, so there's a lot of differences between the two countries. So Vietnam's social supports are limited, and there are a few services funded publicly for people with injuries or disabilities, or the elderly. So the Vietnamese people regard residential care facilities as either for the downtrodden or the abandoned. And so to be relocated to residential care for Yi would be looked upon with shame and would be an undesirable thing. So Yi is also financially quite independent because he's a retired veterinarian, and also his sons, who are very supportive, are physicians. So in Vietnam he would be able to go into a private care facility, but nevertheless this would be considered a place for the abandoned elderly, because the younger generation is expected to look after their parents. Yi's wife has an existing medical condition which limits her capacity to act as his caregiver. So she has stipulated that Yi must be able to toilet himself independently and ambulate independently before he returns home. This has therefore influenced the OT program, and there's been a lot of focus on independent toileting and also other ADL function. So Yi's been in hospital for 9 weeks, and he's been slower to progress than we first anticipated. So Yi's consulting doctor recently brought up the option of moving Yi to transition care plan, the residential pathway, which means that he would be moved to a facility which would give him less rehab than he's been receiving at hospital, but with the aim of moving him to home once he is ready. So Yi and his wife have both shown resistance to moving to TCP because they see it also as a facility and therefore somewhere where he's maybe abandoned or downtrodden. And I've observed how this may have impacted both Yi and his wife's approach to rehabilitation, and they want to make sure that he stays in hospital for a maximum period of time to ensure maximal independence so that he can go home with his wife. And it's interesting to see how dominant Yi's wife is during his rehabilitation sessions in both OT and physio, and I have to consider whether this is because of her apprehension towards what may happen if he doesn't reach his goals. So another cultural factor that's impeded progression of his rehabilitation is his dependence on nursing care in the initial stages of his admission. He was able to do more functional tasks than he allowed the nurses to assist him more than he needed, basically. So I believe this is because there's a strong caring and assistive aspect and approach to the elderly in Vietnam, and Yi probably considers himself to be of the age where he's ready to be looked after and expects those around him to do that. And I believe this may have impeded his progress initially with his occupational therapy program. So thank you for listening, and I better stop.